Medical workers of Reddit, what's the dumbest thing you've seen a person do as an attempt to self-treat a medical condition? Story 1. I had a patient come to the ER complaining of severe pain and swelling all down there. On physical examination we noted a really remarkable amount of swelling, and both the internal and external tissues were extremely red and irritated. She was so swollen she couldn't even pee until we put a catheter in. The physician did a pelvic exam and found blisters on her cervix. We asked when the symptoms started. She said, "Well, it was itching tonight. I thought I had a yeast infection, so I poured a cup of bleach up in there to kill it. But then after a while it kind of started to hurt. Yeah, I bet it did. TLDR, do not pour bleach into your vagina." Story 2. Paramedic here responded to a nursing home for diabetic patient. Unresponsive. The nurse didn't keep up with the insulin and gave a tad bit too much, decreasing the PTS blood sugar. Okay, this is fixable. I walk in to see another nurse pouring Splenda down this lattice mouth. She has snoring restorations and the Splenda is just being inhaled into her lungs. It also isn't doing for this poor lady because it isn't sugar. After give this lady some D54 sugar water she came to, but felt like she couldn't get enough air. She ended up being treated for a few days for pneumonia. I swear, some people get their medical licenses from the bottom of a Cracker Jack box. Love you. Edit. I had a few Redditors ask me if the nurse was a registered nurse RN or certified nursing assistant CNA. This lady was an LPN, licensed to practice nursing I think, I don't know, that's my correction, and I still love you all. Story 3. Animal attendant for a vet clinic here. A client came in and had rubber banded their 2 dogs' ball sacks as a way of neutering them. Very bad. They got the idea from how sheep and goats can be neutered, but there is a huge difference between the junk of a sheep and a chihuahua. Both of the dogs had a severe infection and the tissue was completely dead. The treatment for this cost way more than the neuters would have been. Do not do this ever. Story 4. I worked overnights in a Midwestern ER and I have seen 2 men try to treat their erectile dysfunction on their own. One man used caulk in his urethra and then it dried and cracked like pencil lead and only the 14-inch of the tip came out. He had another 3 inches or so all broken into pieces that required surgery to get out. The other man used a clipped-off piece of coat hanger to try to keep himself erect during, and that also had to be surgically removed. Dudes is weird. Ask for Viagra. Story 5. I used to work in a lab in a hospital in a rural town. I got a stool sample from the ER that was basically a blood clot the size of a golf ball. Sometimes the ER gets mixed up and sends me the wrong specimen, like some kind of body fluid, and labeled it as urine, for example. I called the patient's nurse and asked what the deal was with the patient and if it was really stool they sent up. The nurse I talked to said the patient thought had eaten bad and to prevent food poisoning, drank a concoction of bleach, rubbing alcohol, vodka, ibuprofen and some Tums. Story 6. We are a needle exchange harm reduction station at the clinic I work at. We have 4 drug users come in pretty frequently to get their abscesses cleaned out and dressed properly. So one patient comes in wanting to get her abscess cleaned out like many other patients before her. We take her back to a procedure room and get everything ready to start. She has an ace bandage covering up this spot on her arm, so of course we are thinking it's fine because that's better than just letting it be open to the air. She proceeds take off said bandage and exposes not only huge abscess but a 4-inch length of vein sticking out of her arm that is rotting away and drying up. We are like, what's going on here? And she says she took it out of her abscess and left it out because it made injecting heroin easier. So basically she ran her own for with a vein she cut out of her abscess. We then called the ambulance. TLDR woman came in with abscess. Turned out she cut her whole vein out to make an 4 for easier heroin injection. Story 7. 911 dispatch here. Heard the story secondhand, but kid had a crazy high fever and wouldn't stop crying. Paramedics get on scene, and mom is squeezing a lemon while rubbing it all over the baby's forehead because it's supposed to keep the fever down. Mom was completely at a loss as to why the baby wouldn't stop crying either. It couldn't possibly be the lemon juice you've essentially been squeezing into its eyes for the last 20 minutes. No siree. Story 8. This shouldn't technically count, but it's close enough. I know someone that tried to kill themselves by drinking antifreeze ethylene glycol. She also tried to put the icing on the cake by drinking a handle of vodka. The funny thing about ethylene glycol poisoning is that alcohol is the antidote for it, so she ended up just feeling like in the ER for a while. Story 9. When I was 12 I had a really irritating case of tonsil stones. No matter what I did I couldn't get them out and was starting to get a little desperate. I decided to use a vacuum cleaner, not a small one, an actual household vacuum cleaner on its lowest setting to them out. I ended up bleeding a lot and my uvula swelled up so much my throat almost closed. The hospital still wouldn't take out my tonsils. I was not a smart child. Story 10. A 60-year-old woman self-diagnosed herself with leg cancer and decided to treat it herself by periodically squeezing the cancer out of a centimeter-wide hole in her leg. Yeah, that was a pretty stupid one. Story 11. Giving honey to a baby as a cure to diarrhea. Honey can cause botulism in infants under 12 months. Edit. This is a common home remedy in some cultures, so hospitals see a lot of this. Story 12. As an EMT basic student, I responded to a man who called 911 complaining of an insect crawling up his ear. Upon arrival we ask what ear the bug crawled into. He says his right ear, but keeps complaining about burning coming from his left ear. We noticed his wife standing next to him holding a bottle of insect spray. Upon further questioning we come to find out she sprayed insecticide into his left ear thinking it would flush the insect out of his right ear. I had to explain to her that our ear canals are separated by our brain. Edit. 911 not 991. Yes, it was a typo. Story 13. Diabetic patient. Went to vacation in the Caribbean, left her insulin on a cruise ship, hasn't taken any for a week, gets back to States and Medicaid won't pay for lost or stolen meds, and she refuses to pay for another bottle, because she doesn't have any money. Realizes that no insulin, more sugar in blood. Somehow gets the idea in her head that more sugar in blood means that her blood is now thicker, so she decides to take a bunch of Plavix, warfarin, and aspirin, all blood thinners that cause bleeding, and high doses can and will lead to internal bleeding and death to thin her blood. I get the story when she comes into the pharmacy to get refills on her warfarin and Plavix and ask her why she needs those early. Told her to immediately go to the ER. I have no idea if she actually did. Plavix, sorry, bad typo, thanks for pointing that out, and causes blood thinning. I need to proofread more. Story 14. A younger cousin of mine, upon first discovering masturbation, decided to use ketchup as lube, except, well, he mixed up his ketchup and chili garlic. In an attempt to counteract the burning, he applied toothpaste. Story 15. My sister is an OR nurse. She told me this story. Her coworker was treating a patient who shoved a butternut squash up his rectum and it got stuck. He left it there for a significant amount of time, and when the medical team got it out, it was rotting. They had to shut down that wing of the hospital for the night because the smell was so horrid. Now people tease that nurse by posting butternut squash recipes on her locker. Edit. So, apparently to some, this is impossible. I've texted my sister for more details clarification, but she's probably in bed, so we'll have to update this tomorrow. Edit. 2. Sister can't provide any more details than what I wrote here. She sucks. Story 16. One of my coworkers' most infamous cases. We all have a few. Homeless guy got his finger severed when a metal dumpster lid swung down on his hand. It severed one finger and broke a few other bones in his hand. He went to a convenience store and told them to get him an ambulance, but because he was bleeding they wouldn't let him wait inside the store. He was worried the finger would go cold while he waited outside, so he kept it warm. Guess where? I had a patient who had a bad acid trip. He thought he was being attacked by the canvas people and sawed his right arm nearly off with a jigsaw because apparently one of them bit him and he didn't want to get infected. Mind you, jigsaws are not very sharp. That took freaking dedication to saw through the bone. It was actually still attached by a few sinews when he got to the hospital, but he was combative with the staff, kept flailing around, and the arm didn't last. He actually didn't give about his arm. He was just terrified shitless of the canvas people that were apparently swarmed all over him. Fun fact, that was my second patient ever on my first day at work. That patient's story gets weirder, but that's the short version. Just stay away from sharp objects and power tools when tasting the rainbow. Edit. According to Reddit's Toolman community and a Google image search of the saw in question, the tool canvas guy used may have been something more similar to a coping saw. They brought it in with them and I was told that's what a jigsaw was. Story 17. I had a patient treating her lung cancer with a sonic emitter. Her argument was that sound waves can shatter glass, so lung cancer wouldn't stand a chance. Story 18. I have a buddy that is a medic in the United States Navy. One time when he was on leave and in town, us and all of our mutual friends were hanging out, shooting the before a night of typical drunken shenanigans was surely to begin. He then proceeds to tell me multiple stories to which I could not believe. I have forgotten pretty much all of them except for one. He proceeded to tell me how a young late teens early 20s woman came in complaining of severe stomach pain. He was expecting to diagnose her with menstrual cramps or something else rudimentary and gave her basic pain meds, etc. She came back less than a week later, complaining that the pain had only increased. He decided to send her for an X-ray to get it checked out, and he could not believe what the results showed. It appeared like roots of some sort were twisting and turning inside her abdomen and proceeding to wrap around her spine. Apparently, as a form of do-it-yourself birth control, this young lady had followed her mother's instructions and cut the end off a potato and stuck it all the way up in her vagina. Well, in a damp, moist environment, it began to thrive, as well as partially rot. I cannot even imagine what her gyno must have said, but this story had me in a cold sweat, near dry heaving. Easily tops one of the most disturbing stories I've ever heard. Edit. Emphasis on appeared. He did not say it was wrapped around her spine, just that's what it looked like it was about to do. Story 19. I'm an RN, and at the time I was working in the emergency room. It was fairly late at night and a woman came in with severe vaginal bleeding. Apparently she decided to use a light bulb as and got it in, but couldn't get it back out. She decided the best course of action was to hit it with a hammer to break it and pull out the pieces. I wouldn't consider that self-treating, but it certainly was the dumbest thing I've ever seen anyone do. Story 20. There was a post over on Morbid Reality about a woman who used black salve on her face to treat cancerous cells on her nose. The results were absolutely horrifying. Warning: disturbing images, NSFW. Story 21. Not a medical professional, but I once shared living quarters with medics at a small outpost in Afghanistan. Whenever they weren't busy otherwise they'd see as many locals as they could. I'm working in the back room one day when I overhear this little gem of a conversation. Patient. Through interpreter, I caught an STD recently during a vacation in Pakistan. Context: the locals tend to look at Pakistan like Americans view Las Vegas, a way to get away from it all for uninhibited hedonism when desired. Medic: how bad are the flare-ups? Patient: pretty bad, but I'm trying to treat it naturally. I lean in at this point, ready for whatever explanation is coming. Long silence from the medic, who is trying to process the situation. Medic: how does one treat a STD naturally? Patient: I'm eating a lot of cheese. Story 22. An 8-year-old tripped on the cord of a deep fryer, spilling hot grease on his shoulder and arm. His grandma slathered him in butter to cool him off and draw the heat out. When my medic partner and I entered the house and started assessing the boy, I was saddened and hungry at the same time. The poor kid smelled absolutely delicious.
Nos cannibales.
Story 23. Drug user sprained his ankle while skateboarding high, but couldn't be bothered to come to the hospital, so he acquires illicit morphine from his dealer and proceeds to shoot it directly into his joint. Hello MRSA septic arthritis. For the non-medically inclined, this is very bad news. Edit because people have had questions and misconceptions. Just wanted to add a few things. MRSA stands for methicillin-resistant Staphylococcus aureus. It is a bacteria that is resistant to penicillins and other antibiotics because of a gene mutation, and can be dangerous in the wrong places. It's not a death sentence like people seem to think, because we have drugs that can treat it, most commonly vancomycin or linezolid, but they are not as effective, because rather than kill the bugs, they stop them from growing and need a competent host immune system to actually clear the infection. Also, if you are allergic or in a place without universal health care, they might not be options. Septic doesn't necessarily mean bacteria in your blood. Septic means a systemic response to an infection or inflammatory process. That's basically what anaphylaxis is. You get a bee sting on your arm, but your whole body nopes the out and your blood pressure tanks, leading to complications, like death. Septic arthritis only means there is an infection directly in the joint space. The reason it is so bad is not because the bacteria is everywhere in the body, it's because antibiotics don't penetrate joint spaces very well, so treating it is not treating it or treating poorly leads to the infection essentially chewing up the joint, so you're left with a mangled locked up ankle. The big risk isn't necessarily death, it's disability for life. It's worse in an ankle because it's such a complex joint that can't be replaced like a knee or hip. There is also the possibility of it spreading to the surrounding bone, but if you've caught it early enough, you're usually okay. Story 24. I'm an MD. I saw a patient with cancer get convinced by his chiropractor to stop his chemo and just get naturopathic adjustments instead. He stopped his chemo and thought he was getting better because he was no longer getting the chemo side effects. He died. Edit grammar. Story 25. I'm a pharmacist, so I get a lot of interesting questions, but one of the worst was when I was interning my first year of school. A couple came up with 2 kids, one of which was 1 year old. The baby had a cold and a cough and they wanted to know what they could give him so their family trip to Six Flags wasn't ruined. I had to explain that there are no products for cough and cold for children under 4. The best they could do would be some Tylenol for any pain or fever and fluids rest. Maybe a humidifier. Definitely would not be ideal to be bringing the poor little guy to Six Flags. They scoffed and kept pushing me to recommend a product. Nope, sorry. Had the pharmacist working corroborate what I was saying, they still didn't care, and off to the cough and cold section they went. Sigh, we tried. Story 26. I worked at an OB/GYN clinic for 7 years. One day a girl called and said she had a broken shot glass up her vagina. Upon asking how it got there, she said she was using it as birth control. Thankfully it worked because no one that's stupid should have children. Story 27. My wife is a physician, and during training she had to remove about 3 feet of crumpled paper towels from a woman's vagina. When asked why she had wadded up the paper towel and placed it in her, the woman's response was, "I didn't want my baby to see what the men's be doing down there." Turns out the woman was pregnant, and I guess a concerned parent. LL wife told her to use a condom next time. Story 28. Well, it wasn't really to treat a medical condition, but I did see a guy get a pneumothorax collapsed lung when he tried to pierce his nipple using a nail gun. His aim was off a bit. Story 29. Homeopathy. Q. What do you call alternative medicine that survives double-blind laboratory tests? A regular medicine. The human body is an assembly of chemicals, as is all food, all medicine, so what we label as a drug is a social construct. Neil deGrasse Tyson. Just 2 favorite quotes of mine. I have my PharmD degree. See crazy all the time. Story 30. Ophthalmologist here. I've had a patient who would re-wet her contact lenses when they felt dry by putting them in her mouth, ended up with a central corneal ulcer requiring a transplant. Story 31. ER tech here. A man came in with his wife because he had been bleeding from his bum. He thought that the best way was to self-anesthetize with alcohol, lubricate the area, and cauterize with a curling iron. He actually got it a fair way up before he pulled it out, judging by how much of his rectum turned KFC. We had to remove about a foot of GI tract due to burnt, scarred tissue. The worst part was that didn't even stop the bleeding, which originated farther up the GI tract than the iron would ever reach. There is also the story about a champagne bottle popping off inside someone, but that's another story. Story 32. Surgical nurse here. Ignore it. Had a patient come in. His penis looked like Snuffleupagus trunk. Apparently, while his lady, who was very attractive and not even close to overweight, we had to go check, was riding him one evening, she came down the wrong way. There was a pop, intense pain, but he waited a second and powered through. Said after the initial pain it didn't hurt, so he went to sleep and woke up with it swollen. Wasn't thrilled or convinced that he needed surgery, but reluctantly agreed. We cut it open to drain the blood. Ended up removing some skin. He was uncircumcised before, so we used the extra skin to repair after we repaired the hole through his muscles that we found at the base of his penis. Basically, after we removed the skin, there was a hole the size of a quarter you could look through and see his urethra. According to the urologist, he was unlikely to retain function. I suppose coming in early wouldn't have prevented much. However, his reluctance to have surgery certainly would have had terrible results. Edit. Thanks to Yulink Strelov function could indeed have been saved with early treatment. Ice and an immediate trip to the ER, or is what you should do in order to avoid permanent vessel damage. TLDR patient fractured penis. Not exactly convinced he needed surgery. Went along with it anyway. Edit typos. Story 33 had a frequent flyer patient who had psoriasis so bad that he literally had huge scales all over his legs. One day he gets admitted and the scales are gone. He tells me he took a Brillo pad steel wool and scraped them all off. Surprisingly, it works with no adverse effects and he's still scale-free a year later. Story 34 not an RN, but my diabetic grandpa used to eat all the bread sugar he wanted, and then eat lemon drops after everything. According to him, the real lemon juice acid would counteract the sugar he had just eaten, he was convinced. The nurses disagreed and fought with him for years, but eventually gave in and let him do what he wanted because he was 97 and the food made him happy. Story 35 when I was on placement on an ortho ward I helped treat a woman's arm. We checked her x-rays and both her radius and ulna were severely displaced, almost breaking the skin on her arm. She had waited 3 weeks before getting it checked out. She was lucky that she didn't have any serious complications. Alcohol can be one of a painkiller. Story 36 GP here. The most outrageous thing I've heard was from a boy who was something like 20 to 22 years old, very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically at noon he had to look up to the sun, open his mouth as wide as possible, and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night but only under a full moon. TLDR bite the sun and cure you tonsillitis. Story 37 a slightly crazy guy in my town developed numerous decayed teeth over the years. As they became painful in their turn, he would extract them using pliers. This usually just broke off the crown of the tooth, leaving the roots in place. Then, one fine day, one or more of them caused a severe infection and he had to be medevaced. Story 38 I work at a veterinary clinic and we once had a gruff, old country guy come in with his Australian shepherd. The dog had a huge hanging growth under his neck that was rubbing against the ground and just looked horrible. The doctor strongly recommended he have it removed, and the owner said he could do it again. Apparently, the dog had a smaller growth in the same spot years ago that the owner removed with a pocket knife and bottle of alcohol. No closure, no antibiotics. We were so shocked. The doctor went on to educate him as to why that is not a good idea. He eventually agreed to let us do the procedure, but man was he a difficult son of a bee. We're still not sure how the dog survived the last removal without any problems. Story 39 not a medical worker but I still have a pretty good story. My first year going to Boy Scout camp I wasn't able to go the week the rest of my troop was going so I had to go with a provisional group all the people who went without their troop. Being that way I didn't know anyone in it but soon made some friends. This one kid loved holding his extremely sharp pocket knife in his hand and then throwing it into the ground in front of him. One day he got the idea that the ground wasn't fun enough and decided to try and stick it into trees. We were all just sitting around relaxing in between classes watching him and he throws his knife directly at the tree in front of him. It didn't stick into the tree, instead it ricocheted off of the tree and sliced his shin. Since he was working toward his first aid merit badge he decided he could handle it himself and tied a tourniquet below the cut. We tried to tell him he was wrong and he assured us he was fine and started limping toward the first aid hut with someone helping him. He passed out on the way there. TLDR kid throws knife, gets cut, mends it horribly, and then passes out. Story 40 I work in therapy. Had a referral for an older gentleman that had a minor surgery. Nurses noted that he was incontinent of bladder. He was 95-ish. No big surprise. Went to get him up for a walk. Pull back the covers and notice a large item concealed under his PJs in the crotch area. After some circular talk slowly getting around to bringing up the matter at hand it turned out he refused to wear adult diapers. He was still a man around town in his mind and had to always look his best for the ladies. Since the whole incontinence thing was bad for his game he decided the best course of action was to buy extra large underwear and place his member into a urinal and carry the urinal around in his undies. He said he knew when he was going, he just couldn't stop it from happening so he'd just excuse himself as he was peeing and find a bathroom and empty his secret container. Plus the gals saw the extra bulge and thought it was all him. Giggity giggity. I loved that guy, he was a very memorable patient. Story 41 I work in a hospital lab. A couple years ago, I worked night shift and would routinely get called up to the emergency room to draw blood. I get the call, go up there, and find a 2-year-old boy, completely unresponsive and a mother screaming frantically and hopping around. I draw the blood, go down to the lab, and start my tests. I found an ethanol level of 350 mg/dl blood alcohol level of 0.35, possibly fatal even for an adult. I call it up to the doc and they bring in social services and whoever else to question the mom. Apparently, she found her son in the garage with a bottle of antifreeze and he was acting kinda weird, so she figured he was drinking it. She went online and saw that the cure for ethylene glycol poisoning is ethanol. So she went to the liquor cabinet and started pouring straight whiskey down this poor kid's throat then. Of course, he passed out and she decided maybe they should go to the hospital. Kid lived. TLDR mom gave her 2-year-old alcohol poisoning in an attempt to cure him from possible methanol poisoning. Edit ethylene glycol, not methanol. Story 42 While in China a Chinese female engineer had a cold. To cure the cold she attempted to burn it out using a curling iron. She had large burn all across her back from burning herself repeatedly. Story 43 constitutes for probably the most resourceful instead of dumb. Had a patient who was very self-conscious about the loss of her teeth, made her own dentures out of cotton, the sticks from Q-tips and glue, could hardly tell they were fake. Story 44 I work in a retirement home, and I caught one of my residents with a spoon inside her but, apparently she tried to cure her constipation by sticking a spoon up her booty and trying to scoop the out. Story 45 A friend of mine got drunk at a party and had unprotected with a girl head just met. After he stumbled home he realized what he'd done and tried to fix the problem by dunking his junk into a cup of Listerine. He's now a pharmacist and very proactive about giving advice to dumb-looking teens stumbling around the family planning aisle after midnight. Story 46 On the opposite side, I broke my hand. Stupidly on my behalf I did nothing for a week then said it and went to the hospital. For some reason, they put cast around my wrist and a little metal tab over my finger. This metal tab was not attached in any way and constantly slipped out. At each checkup I asked if they would fix it, only to be told it looks fine to me, just keep it like that. Tried to explain since it wasn't attached it wouldn't stay like that, but they wouldn't listen. TLDR shitty hospital, shitty treatment, had to rig a cast myself, never healed right. Story 47 My patient was instilling honey in his eyes to treat his cataracts and glaucoma. What? Yes, he came in for conjunctivitis caused bacteria were having a party on his corneas. Story 48 Patient comes into the ED with an abscess. Tells us he knew he had an infection and so ate 1.5 pounds of raw steak to get the antibiotics that were given to the cow. Story 49 I edit medical reports. A lot of people are reluctant to take medication for their problems, citing concerns over addiction and side effects etc., so they just drink 15 beers a night and smoke a lot of weed to treat their pain instead. Story 50 TLDR Going to do the TLDR first. Don't put cow dung on a freshly severed umbilical cord. I know this is a little late to the party, but I'll report in as a former public health officer with a fun one and a great solution. I wish I could say I was the doctor at the right place and with the right idea, but this actually was the experience of field colleague. In many parts of the world, from Asia to the Americas, it is a traditional practice to cover the wound from severing a newborn's umbilical cord with fresh cow dung. Many societies believe in a connection between temperature and health and accordingly consider heat to be an important part of healing. One available material that is very warm, easily applied and readily available is fresh cow, right on the belly of the newborn with a cut cord. Needless to say that it is a bad thing to. One common outcome is neonatal tetanus. A colleague, fresh out of medical school in Mexico, was doing a rural health rotation. New docs often have to practice for a couple of years at a rural health station as a part of their payment for med school. In this area, the villagers had this practice and the belief of heat as being important for healing. He kept getting cases of babies with tetanus or other infections, but he couldn't convince the villagers, who generally never bothered with having trained birth attendants present for births, to stop using dung. They kept clinging to their heat belief. Hey, race the brilliant part. He decided to work within their belief system. He said that dung was unclean and unsafe, but there was something else that was very hot and available. Tequila. He convinced people to use tequila, which burns in your stomach when you drink or burns when you put it on a cut. The benefit is not only was it not cow, but the moonshine they cooked up was almost pure alcohol and an excellent antiseptic. The practice caught on and cases of neonatal tetanus in his district plummeted, all because of a brilliant young doctor thinking outside the box. TLDR 2 Young doctor in a rural area convinces locals to stop putting cow on newborn's belly button wound and instead rely on the incredible healing powers of tequila, or as I refer to it, vitamin T. Story 51 Had an old farmer come into the ED one day with a severely infected wound on his head. Turned out he had a growth developing on his head for the past few weeks which turned out to be a tumor. He had been treating it with Roundup, a potent weed killer, because that kills everything. Story 52 Doctor here. A guy shows up in the ER with a live mortar shell in his rectum. Poor guy just wanted to alleviate his hemorrhoid prolapse pain. Obviously the WW2 memorabilia from his father was best suited for the job. Bomb squad shows up and with the surgeon managed to remove the shell. It was not a dud because like this happens in Eastern Europe where people keep retarded stuff in their apartments. Also another guy, construction worker, used metal wire as a substitute for suture thread on his leg, got infected and almost lost the leg. Story 53 My aunt dropped off my grandfather Chinese tiger balm for his sore back. She called him the next day to see how he was feeling. I took 2 tablespoons and it just burned my throat. Story 54 In a triage RN. Had a patient call concerning back pain. I was going about my normal assessment and asked if he had taken anything for the pain, to which he replies cobra venom. Turns out, he had read about Cobroxin, a topical treatment for pain made from cobra venom, and decided it would be more effective to simply let a cobra bite him. I have no idea how he got hold of a cobra. Story 55 Recipient of bad medical care here. A vertical sliding window once fell on my hand and cut the palm very deep. I kept pressure and called an ambulance. A few minutes later a police officer showed up and decided he needed to put pressure on the wound. Now the smart way to put pressure on it, and the way I was putting pressure on it, was by using my other palm to cover the wound completely. This officer decided he was going to go fishing for arteries or something, because before I knew it he had his blue rape gloves SFW on and his thumb inside of the wound. At this point I was screaming in pain and telling him to get his god thumb out of my palm. He wouldn't listen and insisted that if he did not keep pressure that I would lose a lot of blood. Luckily, minutes later the paramedics arrived and took me away from that maniac. I needed to get about 15 stitches and physical therapy because the window almost severed a tendon or ligament. I always mix those two up. Story 56 Parents who keep their children from getting diseases through natural lifestyle instead of vaccines. Nature was the only lifestyle around a long time ago, and lo and behold, that's when all the measles and dead children were around too. Story 57 I just posted, but I thought of another 180-year-old couple meets in the nursing home, new widower, new love, lots of flirting during bingo, evening walks in the courtyard, sharing ensure shakes, things escalate, doors start getting closed, privacy curtains pulled, then one night a frantic 3 a.m. emergency call light is activated. Help me nurse, help me. An attempt to maintain an erection lead to the idea of using several rubber bands around the old fella. Combine that idea with arthritic hands and he couldn't get the rubber bands off. Embarrassment caused him to wait several hours before he called for help and the poor guy almost had to go to the ER. Luckily a really good nurse handled the situation discreetly without causing him extra embarrassment. Never did hear how things turned out with the girlfriend. Story 58 probably will be buried at the bottom, but here it is. I responded to a 911 call for a man bleeding. Supposedly the guy had an angiogram catheter stuck in the artery near your groin to look at the blood vessels near your heart for blockages earlier that day, and was released with explicit instructions to not mess with the bulky dressing. The old coot decides to adjust it, causing it to open, pouring blood out his artery. What does the guy do? He puts duct tape all around his groin. Not just a few pieces, no, all attached to his junk and up and down the leg. It was a noble attempt but did not do much to control the arterial pulsations. Story 59 This guy had a scabies infestation and poured rubbing alcohol over himself to kill the mites. Then he lit a cigarette while he waited for it to dry, second and third degree burns over 80 of his body. Story 60 Oh please let this get seen, not me but a good paramedic friend of mine. He'll keep it short and sweet the way he told me. My first call ever, dude cut off his. Guy wanted to become a lady so he cut off his with a box cutter and flushed it. Seriously, edit I'm too spell good. Story 61 I saw this patient last year. He had a long history of abdominal pain that was quite nonspecific, and his previous workups were negative. He was convinced that he had intestinal parasites that caused the pain, which is an aside. He believed that he got them after an encounter with a woman he met on the internet. So despite having seen several physicians and gastroenterologists, and numerous investigations including gastroscopy and colonoscopy, no diagnostic source for the pain was found. But he was undeterred from believing it was intestinal parasites, so he develops a plan in which he orders surgical instruments and local anesthetic online. Watches YouTube to figure out how to perform a laparotomy to get into his abdomen. And so after his preparations, he performs a self-surgery using a video camera to watch himself, and manages to get into his abdominal cavity. He had trouble completing his self-surgery and called an ambulance.